Today on Vital Insights.
Obviously, one of the most critical, aspects of digital health and remote patient monitoring is the data that's collected and having it be meaningful.
Welcome to an episode of Vital Insights, a podcast series focused on thought leaders and healthcare providers who are working to transform the way we care for patients, now and in the future. So, Terry, in the world of remote or virtual care, there's one thing that's of huge importance, and that's the ability of healthcare providers to rely on the data they're receiving as being accurate. If the data is inaccurate, the whole foundation of the solution falls apart. So let's talk about how manufacturers can ensure their data represents an accurate picture of patient health. By way of framing this issue, I know that you have history with patient data collection with respect to blood pressure. Can you talk about that and what issues you saw come up there?
Sure, Liz. That's obviously one of the most critical aspects of digital health and remote patient monitoring is the data that's collected and having it be meaningful. And when we talk about data standardization and about the validity of data, really, for a caregiver to use the data, they have to, one, understand where it came from, that it's been validated against some standard, and that it's been validated in a clinical setting so that they know that it's meaningful and useful and accurate. And so, from a standpoint of my experience with blood pressure at A&D, obviously that is really one of the key areas of focus on. Like, our reputation in the industry was all around the accuracy and validity and the quality of our measurements. And, in providing clinical data, there's many ways that one can go wrong. And even in providing an FDA-regulated device, I mean, there's really two components to building, commercializing a sensing device for vital signs. I mean, the first part is to develop it and get it cleared by a regulated body like the FDA, or
absolutely,
depending on the country that you're going after. The second one is to have it be validated clinically by a third party, and more countries are requiring both, and often as part of even passing, the regulatory clearance. And so if you look at a device, it's, any kind of sensing device, you're measuring basically an analog signal, and you've got some type of detector that's capturing that signal and digitizing it, and the algorithms to do that. And really, that's what you're looking at, the accuracy of picking up that signal, amplifying it and converting it to a digital signal, and then passing along to post-processing and ultimately into a monitor of some type to present to a clinician or to an individual. And so when you look at that, there's many different ways to do that, and there's many different ways that can go wrong as far as a design standpoint. So really, when you're looking at, comparing the accuracy of data, it really comes down to that signal path and the ability to make that stable across all the use settings, from the size and weight of the patient that you're looking at, the temperature, and the stability of it during shipping, handling, all those kind of things play into it. So the testing rigor that goes into it is really what sets one manufacturer apart from another. And so that's, from an experience at A&D, that's really what set A&D apart from the masses, was just the rigor that they put into that. Now, from a clinical standpoint, when you're looking at that data, the physician that's looking at that data, it's very, very important that that comes back to they understand where that measurement was derived from and what it was measured against. And so when you look at data standardization, let's take activity trackers, for instance. I think there's many, many different algorithms, many, many different ways to track that. If you bought 5 activity trackers, you'd probably get 5 different numbers of steps.
Absolutely.
And different ways to derive it. And that's the kind of the perfect example of talking about data standardization. If you look at blood pressure, theoretically you should be able to get within some relative range the same reading from one to another. And that really doesn't exist in a lot of devices that haven't gone through the rigor of a regulatory environment and this kind of third-party clinical testing.
So if healthcare providers, that's a lot, right? Mm-hmm. So if healthcare providers are looking to ensure that their data is accurate, do you have some advice for them? Like, what top 3 questions would you tell them to ask a potential vendor?
I think it really comes down to, one, first and foremost, obviously, what data are they generating?
Right.
But then the important part is how is it being generated and how are they validating it? And I think the third part, though, really is, has it been proven clinically? That's probably the most important in all of them. Just having regulatory clearance isn't always enough. You should be asking them, has it been validated clinically with a third party? I think that's really, those 3 things are the key. What data is being generated, how are you generating it, and then how have you validated it?
That is perfect. Thank you so much for joining us today to talk about data standardization.